So today we are running through the features and functionality of the ScanTrainer ultrasound simulator, designed to replicate learning one-on-one with an expert. ScanTrainer teaches using real patient scans and curriculum-based teaching across obstetrics, gynecology, general medicine and emergency medicine. Skills are taught and assessed at all levels, making it perfect for someone picking up the probe for the first time, an expert learning advanced sonography skills, and anyone in between. ScanTrainer automatically marks performance based on our expert metrics, so trainees can self-learn in their own time at their own pace. Learn to scan with ScanTrainer, the most comprehensive and realistic ultrasound simulator. ScanTrainer uses haptic devices alongside virtual patients with realistic landmarks to replicate multiple patient shapes. In this way, the system's 15 different virtual patients replaces the need for 15 mannequins. ScanTrainer uses two haptics, one for transvaginal scanning and one for transabdominal, though the new compact system uses just one for both, making it highly portable. ScanTrainer Cloud includes a range of features which extends the teaching scope and learning potential for both tutors and trainees, giving tutors flexibility to manage their programs from the comfort of their own home or office, and learners can complete the pre-scanning learning resources from home too. ScanTrainer Cloud gives users access to the case library, which currently contains over 1,000 real patient cases. In addition, users can upload their own scans to the case library and use them to create their own teaching modules. There are modules for every level of learning, starting from the very basic ultrasound physics and probe manipulation, onto the core scanning skills in any of the specialisms, and then to the advanced skills such as spectral Doppler and obstetrics. Probe manipulation is an excellent place for learners to start and has been deemed a critical part of the learning pathway by instructors globally. It effectively builds fundamental understanding of how the 2D ultrasound images relate to the 3D anatomy, as well as how to move the transducer to acquire the images needed and to correctly examine complex 3D structures. Once we then get to the core skills modules, there are 3 steps for every assignment. First, we start with the learning resources, with instructional videos and textbook-style resources specific to the assignment. Then we go to practice mode, where there is additional help from the inbuilt tutor, ScanTutor. And finally, the test mode, in which the assignment is taken without any help. The comprehensive learning resources are available remotely for cloud systems, meaning trainees can complete the theoretical course remotely before beginning scanning on the system. When running the assignment in either practice or test mode, the simulator guides the user through every task with detailed instructions to follow. There are generic ultrasound controls available in every case. These consist of freeze, depth, zoom, including pan and zoom, focus, sector width, TGC, gain, and cine loop. Learners are taught and assessed on their ability to optimize the image using these controls. Users can further interrogate the ultrasound using M mode and the volume slice feature that shows a user-defined view orthogonal to the fan. This is particularly useful for cases such as congenital uterine malformations, to build a 3D understanding of complex anatomy. Colour or spectral Doppler is also available in some cases. Additional functionality to split the screen, change the fan orientation, annotate the image, make measurements, perform calculations, and capture an image is available in every case. And learners are asked to use these features at various points in the modules. As mentioned earlier, while in practice mode there is an inbuilt tutor, ScanTutor, which helps with the task being performed. ScanTutor helps in 4 ways. First, by colour-coding relevant structures on the ultrasound and in the task instructions. For example, in this task we can see that the structures highlighted are those needed to achieve the correct plane for the crown rump length measurement. Secondly, by traffic lighting the optimization controls, so the learner can see when they're at the acceptable settings. Thirdly, by traffic lighting the probe to show when it is in the correct plane and when it is not. And finally, by showing an instructional video. Once an assignment has been completed, results for the assignment as well as for every task can be seen. Previous results are also visible. This detailed feedback contains expert images, which the user can see next to their own images to see where they went wrong, if indeed they were incorrect. Tutors can see the results of any trainee, as well as progress of all trainees in the user summary. They also have full control over the trainee accounts on the system. To add new accounts, delete or deactivate old ones, and edit assigned programs. All this can even be done remotely for cloud systems. The case library contains over 1,000 real patient cases, and this number is constantly growing as users across the ScanTrainer community continue to add to the library. This means users can scan hundreds of real cases of abnormal anatomy and pathology that would take years to see in clinical practice. The cases are split across 8 specialisms: transvaginal ObGyn, transabdominal ObGyn, general medicine, emergency medicine, head and neck, scrotum, breast, and transrectal. Cases are easily searchable by keyword or category. It is also straightforward to upload scans to the library. Scans can be uploaded from GE to Sheba or Samson ultrasound machines. It is even simple to add ScanTrainer style labels to the cases, or create cases from multiple scans. ScanTrainer is customizable to meet any training need. The uploading scans functionality that we've already discussed is just one way. It is also straightforward to create custom assignments from any of the cases in the library. Alternatively, if the learning content on the system already meets the training need, it can be simply rearranged into new modules or programs for different groups of trainees or class curriculums. The Help button located at the top of the screen gives assistance with this or any of the ScanTrainer functionality. In addition, video tutorials covering a range of useful topics can be accessed from the menu. Learn to scan with ScanTrainer, the most comprehensive and realistic ultrasound simulator.